Hi there everybody, and welcome back to my channel. Today I will be talking about glaucoma, which some describe as the silent assassin. If you want to learn more about this, then please stay tuned. There is a fluid that is found inside everybody's eye, and this is called the aqueous humor. Aqueous humor is responsible for nourishing the structures within the eye. The amount of aqueous fluid coming into the eye needs to be balanced with the amount of aqueous fluid leaving the eye. When there is an imbalance, the pressure within the eye can increase, and when the pressure within the eye increases, this can cause damage to the nerve in the back of the eye. The nerve in the back of the eye is responsible for transmitting information from the eye to the brain, and therefore is essential for visual processing. You can think of the nerve as almost like a wire that transmits information to the computer, which is the brain. And as I said, this is essential for visual functioning and processing. Now, where it gets confusing with glaucoma is that there are several different types, and the different types are not always caused by high pressure within the eye. But as a general rule, high pressure within the eye is bad for the optic nerve. The other types of glaucoma that can occur with normal pressure are thought to be associated with other risk factors, such as vascular risk factors. The problem with glaucoma, and the reason why several people refer to it as the silent assassin, is because it can cause considerable damage to one's optic nerve head before patients actually become aware of the damage that has taken place. So glaucoma tends to affect the vision of patients at a much later stage in the disease process. What tends to happen much earlier is that patients will lose their visual field. That is essentially when you look directly at something, everything that you can see around you is called your visual field. Now, glaucoma will cause damage to the visual field, and therefore patients will start to lose visual field, and they will essentially report chunks of vision or patches of vision missing from their field of vision. This is why it's crucial to attend your optometrist for regular eye examinations, particularly if you are at risk of glaucoma, for example, if there's a family history of glaucoma. And this ensures that the early changes that may be actually present in your eye, whether this be changes to the nerve itself or high pressure, can be detected early. If they are detected early, something can be done about these features at a much earlier stage. And when these are done at a much earlier stage, ultimately you are hopefully preventing any further damage from occurring, or at least you are slowing down the progression of glaucoma if it is an aggressive form of glaucoma. Broadly speaking then, for the ease of description, I'm going to talk about the two types of glaucoma that are most commonly seen. Now, this is open angle glaucoma, where the drainage angles and structures within the eye are actually allowing fluid to pass out. However, there's just an imbalance with the amount of fluid coming in compared to going out. Whereas angle closure glaucoma is when the drainage angle becomes narrower and narrower until it actually gets blocked, and when it gets blocked, this causes a sudden increase in pressure, and therefore patients will be very aware of this. And classically, patients will report headaches, pain around their eye or within their eye. They'll describe halos around lights. They'll have nausea and vomiting. So this is completely different to open angle glaucoma, where for the large part patients are actually completely asymptomatic until much later on in the disease process. There are also several other subtypes of glaucoma which are beyond the scope of this current video, and maybe I will talk about them in videos to come. But there are also a plethora of secondary types of glaucomas which each have their nuances but ultimately cause the same thing, which is damage to the nerve and therefore damage to an individual's visual functioning. The other risk factors to be aware of with glaucoma, broadly speaking, include advance in age, a family history, patients who are taking steroids, and patients who have risk factors that are vascular, such as diabetes and hypertension. Migraines are also an important vascular risk factor which should not be missed. Patients with open-angle glaucoma usually are referred to the hospital eye service and are seen in clinic in due course, whereas patients with angle closure glaucoma will be acutely seen, usually on the same day that symptoms develop. The key step to management is lowering the pressure and evaluating all aspects of an individual's visual functioning. So this involves what they can actually see, what their visual field status is like, what their pressure is, and also performing specialist imaging of the optic nerve head in order to have a baseline measurement and therefore to allow for monitoring over time. Unfortunately, when damage has occurred due to glaucoma, the damage that has already taken place cannot be reversed. This is why it is crucial to detect it early and to therefore try and prevent any further damage from occurring, or at least trying to slow it down as much as possible. In terms of managing glaucoma, it can initially be done with drops. There are also laser treatment options available, and ultimately, when there is advancing or advanced disease, patients may need to have surgical interventions performed. There are also new devices such as tubes that can be inserted into the eye, which can be performed at an earlier stage prior to surgery taking place. The actual management that you will require will be specific to the type of glaucoma that you have, but as a general rule, the overall principle for all different types of glaucoma is to lower the pressure and therefore trying to reduce the risk of further damage to the nerve. Patients with glaucoma should take their drops as prescribed, and it is important to take them unless you are told otherwise. I have seen several patients that are given glaucoma drops, and for various different reasons, for example, their prescription was only valid for a handful of months, they are unable to obtain a new prescription or are unaware that they need to continue, and as a result, when they're seen in clinic months or years later, their glaucoma has significantly progressed, which is very sad indeed. Patients with glaucoma require lifelong follow-up, and in yesteryear this was performed and carried out at the hospital. However, in recent times there have been moves to try and move certain categories of patients into the community where specialist optometrists will manage their care. Thank you so much for watching this video about glaucoma and the different types. If you've liked this video, please give it a thumbs up. Please like, subscribe and comment. Until next time, thank you.